One of the things that in the compacts is really heavily focused on is global health security and emerging diseases and how those are dealt with.
Absolutely. And that I think points to the importance of what they're doing with these bilateral data and pathogen sharing agreements from a larger US national security standpoint. We don't want our biopreparedness and our ability to respond to a pandemic or to a variety of other things to be contingent upon reliance in a multilateral organization. And at the same time, those agreements are still protecting individual patient data.
Interesting that you bring up malaria. That's actually an area that APT has been really involved in addition to HIV. We have been working on malaria prevention for many years, and particularly the vector control of malaria, whether
Mhm.
that's killing mosquitoes through indoor residual spraying or protecting people through bed nets or the analytical work and entomology to really understand the biology of the mosquito and how it's evolving. In fact, that work actually discovered a new mosquito species that entered first into Ethiopia and now has spread throughout Africa that
Wow.
has very different behavior patterns that's made malaria very complicated to combat.
So much focus has been on the programmatic elements of global health. So, the Bureau of Global Health Security and Diplomacy has taken on a lot of work related to implementing PEPFAR, PMI, TB work, a variety of other global health work. But prior to that consolidation of the programmatic piece, GHSD was originally stood up to focus on health security
Mhm.
and health diplomacy. And so I think over the next several years, it would be great to see some real thinking being done on what are our long term health security interests. The bilateral agreements have some really key components to that I think state could be building
Yeah,
upon.
things like the data sharing agreements for
Right.
pathogens and other
Exactly.
things like that.
Pathogen sharing. But then also on the health diplomacy piece, there's a lot of really interesting pieces there as well. So, for example, with pharmaceutical supply chain independence, what would forming a coalition of allied countries around that issue look like? And how
Mhm.
could state really lead in that charge through GHSD, but then work for the benefit of some of the more domestically focused agencies that are also thinking through pharma supply chain independence?